Have you ever wondered if the food on your plate could be influencing how your joints feel, especially when living with arthritis? Many people often hear about dietary changes for joint health, and gluten frequently comes up in these conversations. Gluten is a group of proteins found primarily in wheat, barley, and rye. For the vast majority of individuals living with arthritis, consuming gluten does not directly cause or worsen their arthritis symptoms. However, there are specific situations where a connection might exist, which we will explore further. The primary reason gluten is sometimes linked to health conditions is its impact on individuals with celiac disease, an autoimmune condition where eating gluten triggers an immune response that damages the small intestine. This can lead to widespread inflammation throughout the body. There's also non-celiac gluten sensitivity, where people experience symptoms like joint pain and fatigue after eating gluten, even without intestinal damage. It is important to note that most types of arthritis, such as osteoarthritis, are not typically connected to gluten consumption, but the picture can be more nuanced for autoimmune forms of arthritis like rheumatoid arthritis or psoriatic arthritis. If you suspect that gluten might be affecting your arthritis symptoms, the most crucial first step is to consult with your doctor or a registered dietitian. They can help you determine if testing for celiac disease is appropriate. It is vital not to self-diagnose celiac disease or attempt a gluten-free diet before testing, as this can interfere with accurate diagnosis. If celiac disease or a gluten sensitivity is confirmed, then a medically supervised gluten-free diet would be necessary. For those without a diagnosed sensitivity, focusing on a generally anti-inflammatory diet, rich in fruits, vegetables, and lean proteins, tends to offer broader benefits for arthritis management than simply eliminating gluten without cause. Understanding the difference between a true medical necessity for a gluten-free diet and a perceived benefit is key. Unnecessarily cutting out gluten can lead to nutritional deficiencies if not managed correctly, as many gluten-containing foods are fortified with important vitamins and minerals. It also significantly restricts your diet, making meal planning more challenging without clear evidence of benefit. Professional guidance ensures you make informed decisions that support your overall health. Ultimately, while gluten is a significant dietary factor for some, especially those with celiac disease or diagnosed sensitivities, it is not a universal trigger for arthritis symptoms. Maintaining a balanced, whole food diet, listening to your body, and working closely with your healthcare team are your strongest allies in managing arthritis effectively and making dietary choices that truly support your well-being.